Last week marked an important milestone for us here in Torbay. It was the week where we saw the vast majority of children returning to school after some time at home because of the lockdown. About 97% of children who we expected showed up on day one, and the attendance has been very high throughout the week. One of the things that has allowed us to have our children and staff safely return to school has been the ability to test using rapid tests. These give results in 30 minutes. And some 11,000 tests have been done last week, resulting in about 4 positives when we had the last reports at the end of the week. That's really positive in the sense that it means our background rates are low, and those results also reflect the statistics that are coming out in terms of the number of new cases being reported, the number of people in hospital, the number of deaths. All of these indicators are coming down steadily in Torbay. When the Prime Minister announced the roadmap that would lead us out of restrictions, some of the things that were highlighted were the fact that we needed to see the background rates continue to decrease, which would reduce the pressure on the NHS, and I think we're seeing that. The vaccination rollout has been very positive and progressing very well. For example, the vast majority of our care homes have had a first dose, and uptake has been very good. We also have to date no indication of any of the new variants of concern in Torbay. So everything is pointing in the right direction for us to be able to enjoy further freedoms at the end of the month. We look forward to being able to spend time outdoors. We'll be able to mix with people from other households as long as we maintain social distance and as long as we keep to restrictions. So no more than 6 people from different households being allowed to interact. And again, making sure that we keep to the measures of social distance and using face coverings, etc. Another thing happened last week that is also important as we look forward to the easing of restrictions. We had an outbreak in one of our care homes. And that's important because the vast majority of people in that care home had received 1 dose of the vaccine. And what that illustrates is that the vaccination program on its own will not prevent outbreaks. And in fact, that was never the intention, the primary intention of the vaccination program. What it was designed to do, and I think what that outbreak illustrates, is that it decreased the severity of illness. So we didn't have anyone we didn't lose anyone to date as a result of that outbreak. And the number of hospitalizations was low. In fact, the majority of people were picked up from routine testing. Many of them did not have any symptoms at all. But what the outbreak illustrates is that we can't rely too heavily on any single public health approach. It's all of these things working together. So it's important that even when people have had their vaccination, that they still maintain social distance, they still keep face coverings, they still continue to maintain their hygiene. And in the care home, it's easy, for example, for staff to feel because we've had a vaccination, we're now safe, and don't need to be as vigilant in terms of using face coverings or face masks in the setting of work in a care home, or being careful about hand washing, or even how you socialize, that very often some of the contact points may be not in the work areas, but in the social areas where staff might come together and drop their guard because they feel, because they've been vaccinated, that they are safer. And that just illustrates how important it is that we maintain all of the public health measures as we move into the next phases of the roadmap. A lot of people have been working very hard and continue to do so to ensure that testing is available, that the vaccination program continues to roll out at the pace that we have. And those things are the things that give us the greatest confidence that this time we will be able to hold the gains that we've made as we come out of lockdown. The tests that are available now allow us to detect people who may be carrying the virus, who may be able to transmit it to others, whether they have symptoms or not. If anybody comes back positive, it's important that they isolate immediately and that we are able to work with them to identify their contacts, who in turn can isolate and thus break the chain of transmission. It's also important that we vaccinate and continue to vaccinate those at highest risk, so that even if we have breakthrough infection, the impact on the most vulnerable will not be as severe, and therefore we can see reduction in the number of people needing hospital care, the number of people who sadly succumb because of COVID-19 infection. Using all of these measures together, I think we can look forward to the next milestone when we can begin to enjoy more activities outdoors, but ensuring that we maintain all of the measures that have been helpful to get us to this stage. We can see each other outdoors, but we need to ensure that we maintain social distance, we wash hands, we use face coverings as appropriate. Where possible, we continue to work from home, that we restrict the number of non-essential activities that we take part in. By doing all of these things together, we can ensure that the numbers remain low and that we continue to make steady progress through the roadmap into a new normal as we emerge from these restrictions.